Hello, everyone. My name is Jordan Passano, and I'm the Community Health Coordinator with Prevent Blindness Wisconsin. And today I'm going to present to you all about glaucoma. So, a little background on Prevent Blindness Wisconsin and the work that we do. So, we are a nonprofit that was funded in 1958, and we are located in downtown Milwaukee. However, we do serve the entire state of Wisconsin. And our mission is to improve the lives of children, adults, and families through the early detection of eye conditions. And we do this by conducting ongoing vision screenings statewide, as well as public health education. And our vision is for each Wisconsin resident to have healthy vision at every stage of life as well. A little bit more about what we do is we have many partners throughout the state of Wisconsin that we help support with their vision screenings. Some of our partners consist of the Wisconsin Health Departments, shelters, free and reduced clinics, the Wisconsin Lions Foundation, even universities and high schools, and much more as well. So just this past fiscal year alone, we have impacted over 349,000 Wisconsinites through our preventative vision health programming. We have also served over 138,000 with our direct preventative vision health services. We have conducted 54 statewide vision screening trainings, and 34 of our partnership agencies have viewed our online training video. And with that, we have trained and certified over 1,400 individuals as certified vision screeners. So this is this map of Wisconsin, just showing how many people per county that we have reached. So it's pretty cool to see it laid out this way. Again, we have reached these individuals, whether it was through our trainings, our vision screenings, our public health education, or our FI newsletter as well. So that's a little bit about PBW. Next, I just wanted to talk about Wisconsin's adult vision health and just what the need is here. So about 66% of Wisconsin adults ages 40 years and older have some type of visual impairment or eye disease. And with that, 44% of older adults don't think that they need to seek regular vision care because they don't have any current concerns or issues with their sight. However, many of these adults are living with a vision concern and may not even be aware of it. So, Wisconsin's risk for vision concerns consists of the adult population living with diabetes, obesity, binge drinking, and smoking. So, all of these risk factors can lead an adult's risk and increase them to possibly developing a vision concern over time. A little bit more about Wisconsin's adult vision health. So within the next 40 years, age-related vision concerns are projected to double. The average adult reading level in the US is between grade levels 4 to 6. However, many materials presented at doctor's offices are at an average of 8th grade reading level and above. So you can see here that there is a health literacy barrier, especially when it comes to a client understanding their diagnosis or treatment plan. There is a health literacy barrier here. So with this, I also wanted to do a brief eye anatomy here, just to give everyone a little bit of a background with the system that's working. So here on the front, we have the cornea, and this is where we see all of the refractive errors occur due to the irregular curvature of that cornea. In the middle here, we have the pupil, so that's the dark center spot that we can see. Sitting right behind that, we have the lens of the eye, which is where cataracts forms due to the cloudiness of that lens. Shifting towards the back of the eye now, we have the retina, which is right here. And then the little canal behind that is our macula. And then we have our optic nerve here, which is the main communication channel between the eye and the brain. So essentially, when light rays enter our eye, it goes through the cornea, the pupil, and the lens, and then it strikes the back of the retina at a single point. That then travels to our optic nerve, which then travels to our brain, and then that essentially shows us our everyday image that we are seeing, which is pretty neat. All right, so getting into glaucoma here now. So a little bit about glaucoma and its statistics. So about 3 million Americans have glaucoma, and 50% of people with glaucoma don't know that they have it, and we'll talk a little bit more about why that is in the coming slides. So with glaucoma here, this first image is showing what healthy, normal vision essentially looks like. So you can see that the colors are pigmented. It's a clear, crisp image here. And now the second image is what it were to look like if you had glaucoma. So as you can see here, right away, it's just a lot more hard to see. And also that peripheral or side vision is lost as well. So with glaucoma now, what this is it's a group of diseases that damage the optic nerve. And so when that optic nerve is damaged, peripheral or side vision is lost. And so this can happen so gradually that it often goes unnoticed until significant irreversible vision loss occurs, which is why it is known as the sneak thief of sight. So with this, we have two different types of glaucoma, essentially. So we have open angle and closed angle. So with open angle, this is also referred to as chronic glaucoma, and this progresses more slowly. It is called open angle in reference to the chamber of the eye that should remain open to allow the natural flow of fluid through the eye. And so with open angle, this is when that fluid drains too slowly from the eye, which then results in pressure building within the eyeball. Secondly, with closed angle, this can appear suddenly and is often painful. With this, vision loss can progress more quickly, which makes it very important to seek medical attention as soon as possible. Also with this, that with the drainage system of the eye, it becomes blocked, which again, that pressure increases more quickly, and vision loss also occurs more rapidly here. Also, many are familiar with the puff test at the eye doctor's office. And what this does is it checks the pressure levels within the eye. Glaucoma is closely linked to the increased pressure of the eye, which can essentially damage that optic nerve. So the puff test is to see if there's any glaucoma present. Again, with this image here, you can see with that second eye here, this is resembling an eye that has glaucoma. So with this, you can see that buildup of fluid happening here, which then essentially increases that pressure within the eye, and then that pressure then causes damage to that optic nerve right back here. So some signs and symptoms of glaucoma. So typically we don't see any symptoms. However, you may experience a loss of vision, particularly that side or peripheral vision loss. You may experience blurry or foggy vision, maybe even difficulty adjusting to darker rooms. You may even notice rainbow-colored rings around lights. However, even without any early warning signs, you may still have glaucoma. So with this, we recommend don't wait for problems to occur before getting a regular dilated eye exam. So some risk factors here with glaucoma. So the first one is having that high eye pressure that I mentioned before. Also aging, so anyone over 60 years and older is put more at risk. family history, race, even with African American, Hispanic, Latino, and Southeast Asians. This occurs about 5 times more in African Americans. Gender, with that, males are put more at risk, and also any underlying health conditions, most commonly with diabetes and high blood pressure. So, a little bit more about that risk factor with family history. So, studies have suggested that more than 50% of glaucoma is familial, especially among siblings. And so, the rate of glaucoma can be 10 times higher among individuals with a sibling that has glaucoma. So, getting into some treatment options now for glaucoma. So, the most common one is medications via drops or pills. With this, that medication helps reduce pressure in the eye by decreasing that is produced by the eye or helping fluid flow out of the eye. This must be taken every day as prescribed by the eye doctor and also requires regular visits to the ophthalmologist after being diagnosed. So some more treatments here. We have MIGS, which stands for minimally invasive glaucoma surgery. And this is just a broad term for glaucoma treatment that umbrellas into different treatment options. So the first one would be laser surgery. What this is it's a repeat of laser strikes aimed at that drainage system of the eye. It does cause inflammation, which then allows tissue to heal and become more loose. This also increases fluid flow into the drainage system of the eye and is also found to drop pressure in the eye by 20%. Secondly, we have a canaloplasty. This is when a microcatheter is placed into Schlemm's canal of the eye to help with the outflow of fluid. And you can see that pictured right here. And once that catheter is placed in the eye, a gel is left to fill the area, which helps keep the canal expanded over an extended period of time. We also have a treatment with implants and shunts. These are placed into the drainage system of the eye to help with the aqueous humor outflow via an eye stent inject. Also, a fun fact is that the iStent inject is the world's smallest medical device approved to be implanted in the human body. And you can see that compared to a penny here. So you can really see how small that is, which is really fascinating. So we have many questions on how often should I receive a dilated eye exam? So with that, the recommendation is for adults 18 to 59 years old that do not have any risk factors for vision concerns. They should get a dilated eye exam every 2 to 4 years. However, if you are within the same age group, but you are diagnosed with a specific vision concern, or you are at risk for one, you should get a dilated eye exam every year or as recommended by your eye doctor. Adults diagnosed with glaucoma should go in every year, and then adults 60 years and older should get a dilated eye exam every year because within this age group, you are put at a more increased risk for developing a common eye condition as well. So we also have many questions about what the difference is between an undilated pupil compared to a dilated pupil. So with the first image here, it's resembling that undilated pupil. So as you can see, that eye doctor cannot see much of the back of the eye. I can't really see that retina, and they can't even see the optic nerve. However, on the flip side, with a dilated eye exam, it really opens up that pupil and allows the doctor to see a much larger portion of the retina and also the optic nerve here too. We also recommend to check out our website. We have many different adult vision health resources on there, such as how to make an eye doctor appointment, different fact sheets, different public health educational videos, volunteer opportunities, and much more. So we recommend you to check out our website, and we have it linked in here as well. We also recommend that you check out our national office, Prevent Blindness. They have a glaucoma community, which is a free app. This has many different research articles, daily news feeds on glaucoma, recommended daily habits if diagnosed, glaucoma treatment options, and also community support. So we highly recommend that you check this out, and we have it linked in here as well. Thank you all for joining the Lunch and Learn with Glaucoma today. If you have any questions, you may feel free to shout those out or put them in the chat box. And I also have my contact information provided on here as well. So thank you very much for tuning in today.